I'm Christine Fellingham, and I'm here today with Dr. Julene Samuels, a board-certified cosmetic surgeon out in beautiful Norton Commons. Today we're here with her clinical patient care coordinator, Mindy, a woman who wears many hats, and we're here to talk to them both about some non-surgical options that can rejuvenate, brighten, freshen your skin. And we're starting, I think, first with microneedling. You've probably heard a lot about it. Dr. Samuels, can you tell us a little bit about what patients can get with microneedling?
Right. So now we're talking about retexturizing the skin, working on skin smoothing, tone, texture, fine lines, large pores, scars, acne scars. So we have a lot of tools in the chest. We have microneedling with very, very little downtime, which we call Exceed. We have microneedling with a little bit of downtime on the order of 2 to 3 days called Fractora or Morpheus. Then we have Profound, which we've covered in a previous segment, which doesn't have a lot of downtime, but it has 4 to 5 days of some swelling. And then we have all the laser procedures. And we own 3 really magnificent lasers in the office. One provides 0 downtime. Mindy can expound on this, that works on pigment, broadband light. Then we have our skin smoothing tools, the Core fractional CO2 laser, the Cyton, which is based off an Erbium platform. And we combine that with skincare to try to help patients in either a completely non-invasive way or a minimally invasive way.
Okay, can we talk a little bit about the non-invasive ways you can help patients? Because I know that's usually what gets us in the door. We want to try something that has no downtime, but dramatic results. What comes to mind first for you, Mindy?
I would say the X-List, radio frequency. You're not going to have any downtime. You're going to be pink for about 20 minutes. Feels like a hot stone massage. The provider will work on you face and neck for about an hour. I actually will show patients in the mirror one side, and you can already see a little bit of difference, although over the next 3 to 6 months, you're going to continue to build some collagen, good elasticity of the skin, but it's going to help contour the neck, the jowls, the face. You'll probably get a 20 to 30% improvement, and it's noticeable. And we do packages of 4, and then I do recommend that once a year you consider doing a package just for maintaining.
Now, I think I've heard that you've actually performed this on Dr. Samuels. Is this true?
She begs me to. At the end of the day, she'll beg me to do a little X-List on her neck, just because we have to keep our surgeon looking good too. So she loves that treatment.
No, I know you look incredible, Dr. Samuels. That's not the only treatment you've tried, and I think that's something that makes you unique. You're a woman surgeon who also has lived through the same thing that your patients do, but you also try the devices.
Well, I'm blessed to have providers with me that can recommend treatments independently to patients. Even though we treat patients a lot together, and Mindy's a great first assistant in surgery or as a laser specialist. So we sort of triage patients, but then of course we have to try our own little toys. So recently during the quarantine, I had a light core laser. Mindy did that for me to work on, brown spots, fine lines, large pores. And I was healed within several days. That's what I needed at that time. But we can do deeper laser resurfacing as well. And you get more results the deeper you go. But of course, there's a little more downtime. So I try to squeeze in the things that I can when there's not a lot of downtime. So I've had Profound, I've had Sculptra, I've had the Core, and my girls do that for me. It's kind of hard to do that yourself. So I think that's our goal, is just to try to work things in. All patients have downtime and recovery and budget restrictions. So yeah, we work on each other.
Now, when do you recommend lasers that do require some downtime? When is it time to kind of step up to some of the stronger lasers that actually do some resurfacing on a deeper level?
Well, if we see a patient who does require something deeper than you can achieve with just a 2 to 3 day downtime, I think that's important to point out to patients. For instance, deep acne scars, deep wrinkles. And you can either do many smaller treatments and a series has additive results, or you can go a little deeper and kind of one and done, have it done with about a week to 10 days of downtime, is typical with most of our devices today. So the patients take on that is very important. But we try to do as much as we can in a single session for them so that they achieve a better result faster.
So it's really a choice. You can be one and done, like you said, and have that downtime, or
With
space it
maintenance.
with maintenance, or have the lighter treatments, come in a few times and have long lasting results
Right.
without the downtime.
Right.
And it sounds like you have fun doing it too.
What we do, it's fun to see that change in a patient. Some of our patients you've interviewed, it makes such a big difference. And it's amazing when you watch people as we age, you spend a lot of time, negative energy and time thinking about things that bother you. And when you can sort of erase those or downplay those, it makes such a difference in the way patients see themselves.
Well, it's been incredible to see the difference you've made in so many patients' lives. And it doesn't have to be hard. It can be quick with no downtime, as these ladies are talking about it. It can be quick and easy and something you can fit into your life and your budget. So thank you so much for sharing all of this information with us today. It really makes it less intimidating. And I know women are happy to hear that they can come out here and be taken care of.
Thank you.
Thank you both. So if you'd like a makeover, or if you know a friend who might, go to the Great Day Live Facebook page and share your stories. We would love for you to be next.